Hello everyone. So today's unit is unit number 3, the assessment and management of the pregnancy of antenatal. So what is pregnancy? Pregnancy is defined as carrying a fetus or an embryo in the womb of the mother, that it begins at a fertilization and ends at the delivery of the fetus. And the pregnancy lasts for about 40 to 42 weeks. So the pregnancy is a period from fertilization to the birth of the fetus or a baby. It starts when the male sperm fertilizes to the female cell, that is ovum, in the woman's fallopian tube, and that forms a zygote. After the forming of the zygote starts to divide. After the 7 to 5 days of dividing and growing of the zygote, it gets attached to the uterus wall, and that is called implantation of the zygote in the uterus. Now, after the implantation of the uterus in the embryo, the placenta starts to develop itself in the uterus, and after the zygote is being implanted in the uterus, it is called embryo. After 8 weeks, the embryo is being known as fetus, and the placenta gives the embryo the oxygen, the nutrients, and removes all the waste products from the baby to the mother through the umbilical cord. Now pregnancy facts. A normal pregnancy is about of 40 to 42 weeks and is been divided into the three trimesters. So the whole pregnancy is divided into three trimesters, that are first trimester, second trimester, and third trimester. Now the symptoms that confirms the pregnancy is a absence or cessation of the menses, then the breast changes, tiredness, nausea, mood swings, or other symptoms that we'll study later on. A pregnancy test that confirms a fully pregnancy confirmation through the human chorionic gonadotropin hormone that is present in the urine, and that is the hormone that confirms the pregnancy. By the end of 37 week, a baby is known as a full term baby or a full term pregnancy at the week of 37th week, and its organs are totally ready to get function by itself or by their own. The babies are typically normally weight of the baby is 2.5 kg or 250 grams. Now the stages of the pregnancy. The stages of pregnancy are divided into three parts. First is first trimester, second trimester, and third trimester. The first trimester is about 0 to 12 weeks. The second trimester is about 13 to 24 weeks. And the third trimester is 25 to till delivery, or 40 to 42 weeks. Now, what are the changes that are being observed during the pregnancy? The physiological changes that occurs or are being changed during the pregnancy. These changes are made, these changes are being explained according to the systemic way, and even the changes are seen localized too. Here, the changes of the genital organs, the changes have been observed in the parts vulva, vagina, uterus, isthmus, cervix, fallopian tube, ovaries. Now, in vulva, what all the changes are being observed are as follows. First is edematous. Edematous means this swelling of the vulva area. Then more vascular. The more vascular means the vulva area will be having more blood supply. Then superficial varicosities may appear especially in the multipara. Superficial varicosity means dilated veins present at that part, and in the multipara. Multipara means a mother or a female that have conceived a viable pregnancy for more than one time. Multipara means a female or a mother that have conceived a viable pregnancy. Viable means a living child, having a living child for more than one time. Labia minora are pigmented and hypertrophied. Hypertrophied means a cell's size is being enlarged, means the region of the vulva's cell are being enlarged. Then vagina. Vaginal walls are become hypertrophied, edematous and more circular. This is same as the previous slide, that is of vulva. Then increased blood supply of the venous plexus surrounding the walls. The venous plexus is the arteries or uterine arteries that supplies blood to the uterus and the surrounding organs. The length of the anterior vaginal wall is increased. Secretion becomes copious, thin and curdy white. The secretion that has been secreted from the vagina becomes more highly supplied in the vaginal area, and the pH is being maintained between 3.5 to 6. Now the uterus. Non-pregnant state weighs about 60 gram, means the non-pregnant uterus weighs about 60 gram, and at the term it weighs about 900 to 1000 gram and measures 35 centimeter in length. Now changes that occurs in the parts of the uterus are the isthmus and the cervix, and there is enlargement and increased growth of the uterus. Now changes in the muscles, hypertrophy and hyperplasia that occurs due to the influence of the hormones such as estrogen and progesterone. Now the stretching of the muscle fibers of the uterus are being stretched or elongated beyond if the weeks are beyond 20 weeks due to the growing fetus, and due to the extension by the growing fetus, the muscles of the uterus are being stretched and their walls become thinner. That the thin Now this stretched wall of the uterus becomes thinner at the time of the term, and then it measures about 1.5 centimeter or less than that. Now the arrangement of the muscle fibers. The muscle fibers are arranged as per the outer longitudinal, inner circular and intermediate. Now in outer longitudinal, it is arranged over the fundus, and some of the fibers have been continued with a shape of a round ligaments. Second, the inner circular, it is scanty and have a sphincter-like arrangement around the tubule orifices and the external os. The orifice means the opening, and even the internal os means an internal opening into the vaginal part. Intermediate, it is the thickest and the longest layer that is being arranged in a manner of a crisscross fashion, through which the blood vessels are being run through and gives a perfect blood supply to the reproductive organs. Now the cervix. Cervix is being hypertrophied. Cervix is being hypertrophied and hyperplasia of the elastic and connective tissues. So the cervix cells are being as enlarged in the size, and the number of the cells in the cervix are being doubled or increased, and there is presence of connective tissues as well as the tissues present in the cervix are being elastic in nature. There is increased in the vascularity, that is the blood supply is being increased. Then the softening of the cervix nature becomes very softened, and That softening of the cervix is known as the Goodell's sign. Squamous cells also become hyperactive. Mucosal changes Mucosal changes stimulate the basal cell hyperplasia. So due to the mucosa present in the cervix, that changes the basal cell hyperplasia, that makes an increase in the cells number of the cells, and that is also known as cervical intraepithelial neoplasia, that is CIN. The secretion is copious, that is highly supplied. Copious means the highly supplied secretion present in the cervix, and the changes or the secretion present in the cervix is known as the leukorrhea during the pregnancy, and it becomes more bulky during the pregnancy. Ovary. Now, the growth and the functions of the corpus luteum, that reaches to a peak at the 8th week of the pregnancy, and the hormones that are the estrogen and the progesterone, that secreted by the corpus luteum, that helps in the maintaining of the perfect environment for the growing ovum, and the control and the formation and the maintenance of the decidia of the pregnancy, and that inhibits, that means it prevents the ripening of the follicles. Now, breast changes that is being noticed or being changed during the pregnancy, that includes the increase in the size of the breast, that is marked by the hypertrophy and proliferation of the ducts that are present in the breast. Now the vascularity is being increased in the breast area, that is increased supply of the blood in the breast. The nipples become larger and erectile as well as deeply pigmented. There are glands that are present in the nipple, that is sebaceous gland, and if the sebaceous gland is being hypertrophied or it is increased in the size, are also known as Montgomery tubercles. The outer zone of the less marked and irregular pigmented area appears in the second trimester and is called secondary areola. So the outer zone is being marked mainly in the second trimester and is known as the secondary areola. Now the secretion that is being coming out from the breast, that is colostrum, the first milk, that is known as colostrum, is being squeezed out at the trimester, third trimester, that is 12th, second trimester, that is 12th week of the pregnancy from the breast. Now cutaneous changes, that is the skin changes seen during pregnancy. First is in the face, that is chloasma gravidum or pregnancy mask, that is an extremely pigmented form of the face that is present on the cheek, forehead and around the eyes, depends on the mask. Now in abdomen, linea nigra. Linea nigra is a brownish pigment that is been found from the xiphoid process till the symphysis pubis. From the xiphoid process of the sternum till the symphysis pubis, it is a midline brownish black color midline that is found between the xiphoid process till the symphysis pubis. Now stria gravidum. Stria gravidarum is slightly depressed linear mark or the stretch marks that has been present on the abdomen